Hello, and welcome to the Food Security for Equitable Futures expert interview video series, where we interview experts in the field of food insecurity to gain a non-technical understanding of this pressing social problem and how it can be addressed. I'm Jasmine Farayohan. I'm a senior lecturer in sociology at Lancaster University in the UK, and I'm the principal investigator on the Food Security for Equitable Futures project. I'm happy to be here with a leading expert in food insecurity. So to begin, please could I ask you to just tell us a little bit about yourself, including your name, your current institution, and your areas of research interest.
Thank you. I'm Alula Pankhurst. I'm the Ethiopia Country Director for Young Lives, which is an international research project in 4 countries in Ethiopia, India, Vietnam, and Peru that has been following 3,000 children in each country since 2000, so now 20 years. And we've been looking at the children and how they grow up from birth through to early adulthood. I've also been doing work on longitudinal community studies with a project which was with the University of Bath at one point called Wellbeing, Ill-Being Dynamics in Ethiopia, that is interested in longitudinal change at a community level. And I've live in Ethiopia and have worked here teaching at Addis Ababa University for 16 years in social anthropology. So that's a little bit of a background to me. And in terms of food security issues, I was working with a project with the Wageningen University in the Netherlands that was called Linking Emergency Assistance to Food Security LEAFs. And it was part of the disaster studies group in Wageningen University. And we did a little bit of research on food policy and how that evolved in the country, with also some PhD students involved in that. And as a result of that, we produced a book that was called Food Security, Safety Nets and Social Protection, and which was based on a conference that we held on food security issues and I edited with a number of colleagues. So I've had, and that was a book published by the Forum for Social Studies, which is a think tank in Ethiopia that organized the workshop, and that was in 2013. So my interest in food security goes back to that period, and also the well-being, ill-being dynamics in Ethiopia research, although it covers sort of everything from economic growth to food security. The question of food insecurity has been one of the issues that was particularly of particular importance in our research, especially about the Productive Safety Net program in Ethiopia, which is the sort of flagship, biggest food security program that has public works and direct support for food insecure people. So we did look at some aspects of that in the Wellbeing, Ill-Being Dynamics in Ethiopia program. And then my current role as the Young Lives Country Director, the Young Lives research, again, looks at all aspects of children's lives, but early nutrition and food security were key components of the research that we were doing, particularly on the issues of stunting and especially recovery from stunting, with some really important findings regarding what we now term catch-up growth, but we can come on to that.
Could I ask you to just say a little bit about stunting? Just we have a general audience watching, so could you talk a little bit about what stunting is and why it matters?
Right. So with stunting, children who don't receive enough food when they are young, when they are infants, will not reach the same height as would be expected of children who were not. And so that means that their growth is impaired. And until Young Lives did its research, there was a prevalent view that if children did not receive sufficient nutrition during the first 1,000 days, so when they say 1,000 days, it means from gestation, from not from birth, that if children are malnourished in that period, there will be lasting and irreversible effects. Now, since Young Lives looked at children's nutrition from birth onwards in all the 4 countries in Ethiopia, India, Peru, and Vietnam, we were able to show that a significant proportion of children do actually recover from stunting, and even that the effects may continue as they grow up. Of course, that doesn't mean that the early years are not important. They are absolutely crucial. But the fact that children can recover is a really important finding, because it meant things like school feeding are particularly important for vulnerable and poor children. So that was really quite an important discovery of the Young Lives research.
That's great, thank you. So you've obviously done quite a lot of research on food insecurity. You've done quite a lot of research in Ethiopia. I wonder if you have any particular countries or particular regions within Ethiopia, for example, of a special interest to you in your research.
Right. So I'm very much somebody who's done research only in one country. So I know very little about anything about Ethiopia. And even within Ethiopia, there's so much diversity and so many different agricultural systems. And you have highlands and lowlands, and you have areas where people are reliant on cereal crops, and areas where people are reliant on root crops. And there are areas that are cash crop areas, and there are areas where people are more agro-pastoralists and rely more on livestock. So there's an incredible diversity within Ethiopia. And of course, food insecurity can also be an issue in urban areas when the relations between people's production and their income, when there are problems there. And so food insecurity in urban areas has been one of the things that we found out during the COVID period, for instance. Higher rates of food insecurity in urban areas when the purchasing power of urban populations compared to rising prices of basic foods, when that no longer means that people can buy enough food.
Okay. And so is your focus primarily in rural areas usually, or are you focused both on rural and urban?
So I've been involved in 2 different longitudinal research projects. So the well-being, ill-being dynamics in Ethiopia is very much a rural project in 20 different areas. And so we were looking very much at rural food insecurity. And there, one of the big questions was the role of irrigation. And we were finding that earlier on in our study, areas where there was irrigation potential seemed to be improving quite rapidly, with more access to food, and but also rising inequalities. So some people benefiting much more than others. But more recently, we've slightly felt that the role of irrigation is not as wonderful as we had assumed initially, partly because the amount of water that is there and conflicts over irrigated land, and lack of water upstream, downstream problems and so forth, means that it's not a silver bullet that solves the food security issue. And likewise, the question of fertilizers, that fertilizers did seem to improve yields quite a lot, but then affording fertilizers meant that it was only richer farmers that could do so. And also in contexts where there was drought and food insecurity, if you use fertilizers, then there's a shortage of rainfall, you've invested a lot of money in purchasing fertilizers, and often farmers were beginning to get indebted because fertilizer subsidies that the government initially had were being reduced as there was a move towards farmers having to pay the full market price. And so that meant that if you sowed your crops and used fertilizer, and then the rain didn't come, you not only lost your crop, but you were also indebted. So fertilizer debt was a really serious problem that we encountered in rural areas. I should say also that though the wide project, the Wellbeing, Ill-being Dynamics in Ethiopia project was a rural project, we were finding that urbanization in rural areas was actually quite important, because it meant that it opened up alternative livelihoods for people outside just the agricultural sector, and that diversification was quite important both for wealthier people, but also for poor, food insecure people who maybe didn't have the same access to land and to livestock, or didn't have much capital and assets to be able to survive from a rural livelihood. And so the urbanization in small towns and even villages was actually one of the ways in which the poorer were surviving and the richer became much better off. So that was the wide longitudinal research over 20 years that we've been looking at these communities. But the Young Lives study is also in 20 communities, but different ones, and it includes both urban and rural sites in 5 different regions of the country. And so that does look at urban and rural food insecurity issues over this long period, from the children being born in 2000 now to becoming young adults in the early 2020s.
Okay, thank you. I wonder if you could say a little bit more about why it's important to look specifically at children. Why do they matter in the context of food insecurity?
Right. So looking at children is particularly important, partly because they are much more sensitive to nutrition deficiencies, not just in quantity of the food, but also in quality of food. And so if they're not getting a full range of foods, this can affect quite seriously their well-being and their growth. And so, you know, in times of food insecurity and drought, it is the children who get malnourished much faster, and that therefore require supplementary feeding programs. Particularly the infants under the children under the age of 5 are much more sensitive to drought and food insecurity. So that's why it's really critical to work on children. And it's not just the under 5s. We've been finding that adolescence is a second window of both risk, particularly for adolescent girls, because with early marriage, early pregnancy, many young women in these contexts do have children at a young age. And so if they don't get sufficient nutrition in adolescence, there are serious risks of a kind of intergenerational transmission of poverty and food insecurity, that they don't receive enough nutrition, and that can have an effect on their offspring, on their children. So that period of adolescence is also another area of risk and potential interventions to try and avoid the negative effects of food insecurity.
Okay, thank you. So you've obviously spoken a bit about your findings through this discussion already, but I wonder if you could say, what do you think is the most important thing that you've discovered about food insecurity in your recent research, and why is it an important finding?
Right. So I'd say 2 things. I know you said the most important, but I mean, in a sense, I've already touched on this question of catch-up growth, the idea that children who are malnourished, if they still get feeding at a later age, not everything is lost. And so school feeding is critical. So that's one thing. But coming to the more recent research, so Young Lives has done 5 surveys until 2016. But then during the COVID period, we had phone surveys rather than face-to-face surveys. And in these 5 surveys, we've been looking at what happened over a range of things. And in terms of food insecurity, there was some important findings. And one of those was that food insecurity was not evenly distributed. And well, sorry, let me start by saying that over the COVID period, food insecurity increased quite dramatically. It increased dramatically, not just in people's perceptions, but actually when we asked them questions of whether they had faced food insecurity, that had increased over the COVID period quite dramatically. But it also didn't increase in the same extent for all groups. And so we found that there was, in some parts of Ethiopia, in particular in the southern region, what's called the SNNPR, the Southern Nations and Nationalities and Peoples regions, the food insecurity levels were much, much higher than in other regions. And also urban areas seem to be facing large-scale food insecurity. We also found that comparing with the last survey, which was in 2016, the food insecurity had increased quite dramatically. So not just during the COVID period, but actually when going back from 2016 to 2021, food insecurity had increased quite dramatically. And so that raises the question of climate change and the links of, to what extent this is, can we see trends of food insecurity getting worse? And the Horn of Africa and parts of Ethiopia have had quite drastic droughts recently. And so the links with drought are also very important things to look at. And can we then extrapolate and say this is related to climate change? And I think that's one area where one has to be quite cautious, but where there are possible indications that there may be climate change related things. But then when we find high food insecurity in urban areas, that's much more complex. It's not necessarily related directly to climate change, but much more to the questions of economic opportunities, particularly for young people. And in the COVID period, the COVID measures that restricted transport, affected people's employment and jobs, that those effects did have an effect on young people, young families' ability to purchase food, access food, and that is the explanation for food insecurity in urban areas is probably quite different and more complex than in rural areas.
So you mentioned both that there's been a difference sort of in food insecurity levels before versus during COVID, and also that you found some regional disparities as well. Did you find actually the inequalities between regions were increasing?
Yes, so we did find that there was particularly the southern region was the area where it had gone up very dramatically. Although when we look back to 2016, it was already high, but not as high. I mean, the difference was quite dramatic in the southern region, also in Amhara region, but then that becomes more complicated because of the conflict and the war. And we also lost touch with our sample in Tigray with the war in the north of Ethiopia. So the linkages between food insecurity, it's not just food insecurity and drought, but it's also, and climate change, but it's also food insecurity and conflict, because in conflict areas, if farmers can't plow their land and because there is fighting, then the next crop, the season, the harvest is little or low, and that leads to famine or displacement. And so the linkages between food insecurity, climate change, and conflict are really complex. And in Amhara region, we certainly found very high levels of food insecurity. And when we do the next survey in 2023, we will probably find that. And another area that I think is under-researched and where we found some initially very important but also worrying findings is the link between food insecurity and mental health. So we were finding higher rates of anxiety and depression in food insecure households, and that is one of the research findings across the 4 countries that has been quite important. And I think it's an area that has not yet been fully understood and researched properly. But when the anxiety and depression levels of food insecure households, and when that all links up with young people's problems with access to jobs and employment, when it links up with problems with drought and that affecting livelihoods, and when it links up with the constraints under COVID and conflict, all those things kind of get mixed together. And so that the sort of mental health aspect, I think, would be one that is worthy of much more in-depth research.
It seems like, so the Young Lives cohort are sort of young adults and starting their own families now, particularly the older cohort. It seems like a particularly difficult time with all of the challenges that you've just mentioned to becoming of age and starting a family right now.
Yes, absolutely. So we have two cohorts with a 7-year difference. So the younger cohort we followed from birth, and they're now 21, 22, and the older cohort are in their late 20s. And so, as you say, they're at the stage where they're trying to set up their own households, get married, have their children, start new lives. Some of them have gone through education, have reached a certain level, are then looking for jobs and finding there are less jobs than they were expecting. Others are, in rural areas, have gone into rural livelihoods, and there are constraints with less land available and parents not being able to share land with them. So it is a very difficult period. And then with the COVID restrictions, that has also been an additional problem for young people, plus the conflict in a number of areas. And most recently, perhaps the most worrying thing, even beyond those, is inflation. And that's very directly related to food issues, because partly as a result of the COVID restrictions on people's livelihoods and transport and migration and so forth, but also related to the drought and the conflict. This has meant that food insecurity levels have been rising, and that affects young people's livelihoods as they transition to adulthood. And the inflation aspect of it is particularly worrying because all these things have been drivers of inflation: the drought, the COVID restrictions, the conflict, and international issues, particularly to do with the Ukraine war. So Ethiopia is an importer of both wheat and oil from both Russia and Ukraine. And so the increases in prices of basic food, notably edible oil and wheat, but also the knock-on effects on the price increases in petrol, in fuel, has meant that everything, all food items and, well, just everything else, that has fueled inflation. And so even before the Ukraine crisis, we were having month-on-month inflation of above 25%, between 25 and 30%. And it looks like that's likely to increase much further because fuel subsidies on petrol and are being gradually lifted by the government at a time when the inflation is already critically high. And some analysts even worry whether this kind of how resilient people will be able to be, and whether there isn't even the possibility that we will see food riots happening, because when the economy is stretched and people's resilience is stretched, when is the breaking point? When do people just simply can't cope, and when people will take to the streets? Now that hasn't happened so far, and people are somehow, I don't know quite how, trying to make ends meet. But when the inflation keeps going on, and when the opportunities for finding employment, and when rural livelihoods are constrained by drought and other aspects of food insecurity, and if the conflicts are not resolved, some analysts are really worried that we might be entering a situation where food insecurity might actually spark political unrest.
Mm. I wonder if you could say a little bit more. You've mentioned drought a couple of times. You've mentioned cash crops. I wonder if you could say a little bit more about just people's livelihoods, and is there a lot of home production? Is there a lot of cash crop production going on? How are people sort of meeting their livelihood needs?
Right. So, I mean, incredible diversity of livelihoods, and it ranges from groups that are agro-pastoralists in the lowland areas of Ethiopia in the east and south. And so on the borderlands, you have lowland areas where people's livelihoods are very much based on both cattle and some crop production, and they were particularly affected by the droughts. So that in cycles of droughts, people's livestock often a lot of livestock die if there's not enough rain for the grass and for the pasture. And so for the lowland agro-pastoralists, the lack of rain and the then consequent drought has been the major problem. In addition to that, one of the things I didn't mention was locusts. So as if everything else was not enough, we've had really bad locust infestations and swarms in parts of the country, particularly in the south and the east. And then in other parts of the country, people rely on cereal crop production, and the rain regime in Ethiopia has two rainy seasons, a long one and a short one. So the short one in many parts of the country is, well, let me start with the long one. The long rains tend to be more predictable, and it's the tip end of the monsoon in Asia, and so it's usually from July through to September. And most years the long rains are relatively predictable. Sometimes they're too long or too short, or too heavy or too light, but usually it's very, very seldom that you don't get the long rains. Now, the short rains are often actually quite more important in some areas, but the problem is they're much more unpredictable. So they can come anytime from December through to May. And so it's a bit of a gamble when they will come. And usually there's a break between the small rains and the long rains. And so you can have a crop after the short rains, and then another crop after the long rains. But what happens is, if the short rains don't happen, or happen too late, or are too unpredictable, that can mess up that way in which people rely on two harvests. And with climate change, there seems to have been a move towards the short rains tending to come later, and often kind of joining into the long rains without a break in between, which can affect whether you can have these short crops. So the cereal producing areas do depend on what happens with the rains, and climate change seems to be affecting that quite a bit. And then there are areas in the highlands that are much more dependent on root crops, and in particular a crop called Insecurity, which is quite drought resistant. And in parts of central Ethiopia, these are people will often rely on these, what they call them false bananas, that is a root and the stem that is used as a staple crop. It's not very nutritious, but it does provide bulk food. So we talked earlier about children. It's not so nutritious for children because you have to consume quite a lot of it to get enough nutrition, a bit like maize in other parts of Africa. And But one of the problem with insect crops is there's been insect diseases of this false banana plant that have been affecting the crops on which people relied a lot. So, you know, this kind of plagues thing and swarms of locusts, crop diseases is another thing that is affecting agricultural production in parts of the country. And of course, it's also, in Ethiopia, we have a very high population in the highlands, and it's been increasing quite a lot. So that just the population density and the meaning that that leads to smaller and smaller holdings. And that has an intergenerational effect because parents traditionally would be dividing their land to their children, often mainly to the sons. And so as the land shrinks, the ability of parents to then hand on some of their land that is big enough to their children is constrained, which then means children have to migrate out, and only a few of them can remain on the land. So that's another sort of longer term structural problem in the economy, with a high population and reducing land sizes.
Mm-hmm. And does that then link back to the process of urbanization that you were mentioning earlier as well?
Absolutely, absolutely. And so that's, in some senses, I don't want to put too negative a spin on everything. The sort of migration is one of the ways in which some kind of, shall we say, some kind of reduction of the pressure on the land through young people migrating to urban areas, but also the creation of small urban centres within rural areas, even if they're very mini towns, sometimes does provide alternative livelihoods. And with the changes in the economy, with roads and the spread of electrification and mobile phones and you know, the services that go along with that, with starting with basic services of water, education, healthcare, and so forth. This does create employment, does create opportunities, and then young people can diversify. The sort of globalized economy does bring in a lot of opportunities, from small mobile shop repair places through to grinding mills and all kinds of opportunities that can lead to alternative livelihoods beyond the agricultural sector.
Okay. So obviously, there are a lot of things we do know. There are a lot of complex structural problems. Um, I wonder what you think the biggest gap in what we know about food insecurity is. Where do we need more research evidence?
In a sense, I think it's how food insecurity links up with the rest of people's lives, where you know, we tend to think food insecurity, so we think about agriculture, we think of irrigation, but in a context that we were talking about of how livelihoods are changing with globalization, urbanization, how food insecurity, basic production links up with employment, the way in which safety nets work for the poor, migration, and then, you know, broader issues like climate change and conflict. I talked earlier about mental health. So in a sense, I think one can't really say there is one area. It's much more how it links up with the rest of people's lives that is important.
Okay. So you mentioned safety nets, and I wonder if you can say a little bit more actually about social policy. I know you have some expertise in that area. Um, how do you think social policy can address food insecurity, or can it address food insecurity?
Right. So Ethiopia has had quite a lot of experience with this productive safety net program, which is a very large scale program that has been helping address food insecurity in particular areas by having public works. In other words, moving away from just providing food aid towards having food that is provided in exchange for people working and then developing the assets of local areas through tree planting, terracing, and other activities. So that was the model, and in many ways it has been quite successful, even though there are a lot of problems of who gets selected, who doesn't get selected, and who stays on the program, who moves on and graduates, as they say. So there's been some big issues about whether to what extent it can lead to sustainable livelihoods, and whether people can move out of being assistants into managing their own lives, or to what extent it might lead to dependencies and people remaining in cycles of having to receive aid or be part of that food security system, which has been increasing in numbers with 10 million, sometimes going up to 15 million people in the system. And so the question is, will the people be able to move out of that? Will it be something that can be scaled down and so forth? But one of the insights from the wide research was that the safety net system seemed to work best where in places where other aspects of the economy seemed to be working well. So when you had irrigation or urbanization or something else that was provided possibilities for sustainable livelihoods, then the safety net as a cushion worked well for the more vulnerable. But when other things didn't seem to be, the other opportunities in the economy didn't seem to be particularly offering alternatives, then the safety net on its own didn't seem to be really solving problems, because in some senses, traditionally people would, when there was severe drought or food insecurity, people who couldn't cope would move out. But with the safety nets, people wouldn't migrate, and therefore it didn't really seem to be solving things. So that was one insight that came out of that research. And so, yes, there's been a lot of attempts to try and tweak and improve the safety net program and link it to nutrition and gender sensitive programs. So ensuring that pregnant women and lactating women were given precedence in access to food security. There has been talk about trying to make it child sensitive, and whether it should be linked to ensure that whether there should be some conditionality of children going to school in order for the households to get the safety net support. That hasn't actually been implemented in Ethiopia, but there are some debates in food insecurity as to whether transfers should be conditional or unconditional, and a lot of debates of whether the mechanisms of targeting the food to the more vulnerable, whether that's actually efficient or inefficient, or whether you should provide food to everybody, and then that means that the richer people will help poorer people and everybody gets the support, or whether you should target it more specifically just to the really poor. And then you kind of, the advantage of that is that you then mean it gets to the most poor and vulnerable, but it does then can lead to stigma, and then being isolated, and then being separated from the rest, and maybe doesn't build up community help and the links between the better off and the poor and the poorer, and can actually lead to divisions, and is quite administratively very costly, and can be divisive, because it means that you're focusing just on some people, and then people who are borderline, somebody who gets included gets a lot of support, and somebody who's just a little bit better off and is struggling doesn't. So there are some quite complex debates about targeting of food support through safety nets, and also whether the food safety nets can look into other aspects of people's lives, such as education, gender issues, and so forth.
I wonder if you could say just a little bit more, please, about the issue of conditionality, and particularly tying that to children's school attendance. What are the sort of pros and cons in that discussion?
Yeah, so I suppose it's whether safety nets are seen as a way of achieving other things beyond food, just safeguarding people's access to food. And there, in many parts of the world, there has been attempts to have conditionality in using it as a tool, if you like, through in the international and donor community to achieve other objectives. So, for instance, ensuring that children go to school. That hasn't happened in Ethiopia, but there has been a big push of school feeding. And so in a sense, that's does achieve the same thing. And there's been a fair amount of evidence, I think, in Ethiopia that the school feeding has been important in and of itself. I mentioned earlier the notion that Young Lives has been promoting of catch-up growth, that children who didn't receive enough food and were stunted, not the right age or height or weight for their age or height for their age, that these children can recover with feeding, and school feeding can be quite important, but also that the school feeding programs have been quite useful in ensuring that children do go to school and don't end up having to leave school to work to support families. So I think that's an area where the kinds of incentives of providing food to ensure children go to school can actually work quite well, even though the question of conditionality can be controversial because, first of all, of it being imposing something on people rather than it being something that they choose to do. And another perspective would be to say that it's much better to provide food and then allow people to make their own choices of what's right for them and what's good for them. I think I was also alluding to the fact that once you introduce conditionality and evaluations and sort of targeting, that is administratively quite costly and potentially socially quite divisive and doesn't build up in local institutions and local capacity to resolve problems, and can potentially perpetuate dependence. But it's quite a controversial area, and I think the evidence is quite mixed, and there's a lot of debate about the issue of the conditionality of providing food with strings attached, as it were.
Okay, thank you. So we've talked a bit about social policy and the role of the state in addressing food insecurity. Is there anything that that members of the public could be doing to help to address food insecurity, do you think?
When you mean when you say the members of the public, what do you mean on a global level, on a national level? Do you mean for themselves or for others?
I would think both global and national level. I'm thinking, for example, if someone's watching this video going, what could I be doing? Is there a role for me in this? Is there anything that someone with that thought in mind could potentially do to help address food insecurity?
It's a difficult one. I mean, you know, in some senses, a lot of the international UN agencies, the World Food Programme, a lot of the international organizations such as UNICEF do a great job. And so, you know, supporting such organizations can be particularly important. There are also special appeals that come out at, for instance, now with the drought and the locust swarms and the loss of livestock in parts of East Africa, the appeals that NGOs, international organizations are doing are actually can make a tremendous difference. And I think, I mean, for individuals, for the public, becoming better informed about the issues and you know, learning about that. And there are issues about global food equity and you know, understanding, for instance, how the war in Ukraine the knock-on effects of that in as far away as East Africa, and that it has a very direct effect on livelihood. So, you know, in some senses now with the crisis in Ukraine, a lot of assistance is being diverted that would have gone to third world countries or countries that are facing drought and famine in Africa, for instance, is being diverted towards or is being, I mean, maybe that's the wrong word, but is focusing much more on the Ukraine crisis. And yet the Ukraine crisis is having very significant negative effects on livelihoods because of the question of wheat and edible oil, and also fuel prices going up tremendously in this context. So in some senses, people's minds and thoughts and quite rightly are very much disturbed in Europe and the West about what's going on in Ukraine, and it's not in any way to suggest that that is not vitally important. It is, but it's also having very serious knock-on effects on people's livelihoods in East Africa, where there are so many other problems that are also affecting them. We talked about drought, we talked about locusts, we talked about climate change, we talked about conflict. COVID is also, you know, in a sense, people are now almost feeling that talking about COVID is a luxury because there are so many other problems. And so we have very high vaccine hesitancy, very low rates of vaccine, and people, you know, saying, well, so many other problems. But if there were to be, you know, a big upsurge in COVID, and there are some indications that that has been happening, for instance, in South Africa, Ethiopia, for instance, would be very ill prepared because we have vaccination rates which are abysmally low, even, for instance, compared to when we do comparisons with the other Young Lives countries, they're all above 50% vaccine coverage. We're below 10%. So, you know, we're ill prepared even on that count.
Okay. So I wonder, there are obviously a lot of ongoing issues that you've talked about today. Where do you see your future research going on food insecurity?
Right. So we're planning in 2023 to do another round of survey, and we're assuming and hoping that there won't be another resurgence of COVID, and therefore we will be able to move back from doing phone surveys to doing face-to-face surveys. And that's actually particularly important because in terms of food insecurity issues, because first of all, when you do face-to-face surveys, you can do much better, longer interviews, and I think actually when you see people, it's qualitatively different in the way that they respond, but also because our Young Lives children are now adults and they're having children themselves. And with children, in terms of food security research, we can do anthropometric measures, which is looking at their weight and their height, and being able to then assess their body mass index, and therefore whether they are stunted, or that is to say undernourished or not. And so we can then look at the questions of intergenerational transmission of poverty, but also the breaking of intergenerational cycles of undernutrition. And we can look at the questions of maternal nutrition, and whether undernutrition in young mothers, to what extent that is transferred to their children. And we can now even look at 3 generations, because we have evidence of from the caregivers, from the mothers through to the children who are now mothers themselves, through to the young children. So in 2023, we can do anthropometric measures on the babies of the babies who are now mothers, and that means that we can look at the question of what has happened to mothers who became pregnant during the COVID period, during the food insecurity induced partly by COVID, in some cases by drought or by conflict or by just food insecurity that resulted from the lockdown and the effects. And so we will be able to look at this question of the younger generation and the intergenerational aspects. We also, I think, will be very interested in following up in one of the areas of research, which is the mental health effects of food insecurity, which are very critical, and how that also links up with conflict. And we can also begin to look more in terms of, since we have this data going back to 2000, we can begin to at least speculate on climate change impacts on food insecurity. And because we've got evidence across different regions, we can also, and we can begin to look at how regional variations, I mentioned to you that we were finding higher levels of food insecurity in the southern region of Ethiopia, but we don't really know why. So we hopefully in 2023 will be able to unpack understanding to what extent we can attribute that food insecurity. You know, is it drought? Is it pests on the root crops? Is it locusts? Is it unemployment and young people being unable to have jobs? Is it that they haven't been able to inherit land and therefore can't plant crops to feed their young families, and they're just having children, they're married, having children? Is it that they, unable to find employment? So alternative forms of livelihoods beyond agriculture. So I think that for me, what will be really important will be in this new round to look at food insecurity across different types of livelihood, and begin to understand why certain places and categories of people are more at risk, and look at how that affects young people intergenerationally as well.
Well, it sounds like you have a huge task with data collection ahead of you, and with getting at some of those big interconnected challenges, but also like you're going to produce some really important and exciting results. So I know I'll look forward to seeing your future research as that develops. But for now, can I just say thank you so much for your time and for this really interesting and important discussion. And I hope to keep track of your research in the future.
Thank you very much, and we'll look forward to sharing with you. Yeah.
Thank you.